In the last 30 days, the state has reported 105,000 infections, making up half of all COVID cases in Hawaii since the pandemic began almost 2 years ago. The cases seem to be on the decline, just as officials look into new cases of a strain of Omicron in the islands. Nikki Schenfeld reports.
Tens of thousands of people are getting infected every week here in Hawaii, and health officials believe this new BA.2 variant could be why we're not done with the surge just yet. The highly contagious Omicron variant infected nearly as many people in January than all other strains combined throughout the pandemic. Now COVID cases appear to be on the decline. Lieutenant Governor Josh Green believes the state peaked on January 21st.
Cases are 23% off for total cases and 12.8% off for hospital cases. So we're headed down in spite of the large Omicron surge.
8 cases of the new subvariant have been detected in Hawaii, and 8 more are being sequenced. BA.2 has been dubbed stealth Omicron because some experts say it's not as easily detected in tests, and it's closely related to Omicron.
We do have some cases, along with another 25 or 26 states in the United States already confirming it. They called it the stealth variant because it's a little harder to see on tests, but it is definitely detectable.
One of the reasons that we're concerned about it is that in some places, including Denmark and in Calcutta, when BA.1 and BA.2 are both present together, the BA.2 has expanded and become the dominant strain. And there's a possibility that might happen here.
He says that suggests BA.2 could be more infectious.
It is possible that the introduction of BA.2 may slow down or delay the end of this surge.
He says it's unknown if BA.2 causes more serious disease, but in countries where it's taken over, hospitalizations did not increase. For the 100,000+ people in Hawaii who were recently infected with Omicron, officials say you're unlikely to be reinfected with BA.2.
Prior infection produces a level of immunity for sure. And because these viruses are fairly closely related, I would expect a prior infection with one to give some level of protection to the other.
Doctors recommend people who recently were infected to talk to their healthcare providers about when to get a booster shot.
We need to continue to emphasize in public health that people need to be vaccinated, need to wear masks, and need to avoid conditions of crowding and places where people are not wearing masks.
Nikki Schenfeld, KHON2 News, working for Hawaii.